Hello and welcome to the Bpositive Bloodstream, a podcast providing insights, stories and experiences from and for all those affected by acute leukaemia and beyond. My name is Jonjo and I'm the founder of Bpositive and the host of the Bloodstream. I want these podcasts to provide help, inspiration and belief to all people. Bpositive is both my blood group and my adopted mantra that I held throughout my treatment. I hope you enjoy our interviews, and if you wish to get in touch with us, then please do so by emailing us at info@bpositive.org.uk, or you can find us on Twitter at b_positive_org. I'm joined by someone very inspiring called Catherine. I met Catherine a few weeks back now, isn't it? Yeah. When I was at the Royal Marsden, I was asked to give a talk, which I've shared on here before, basically giving my story. You often get questions and things after these talks, and you meet some really interesting people. But Catherine stood out to me because he popped over to me and first of all said you enjoyed the talk, which is always nice. But it struck a chord because you said you'd had a similar illness to me. Yeah, I was in a room full of people who were trained professionals, hemo-oncology professionals of some sort. So to hear that you've gone from having experienced something very similar to myself to now caring for people who were like you were and I was, really stood out to me, and I was really keen to come over to sunny Newmarket and to interrupt your day and have a chat, and that's really what I want to do. So for everyone listening, Catherine, correct me if I'm wrong, but I think you were diagnosed with B-Cell Non-Hodgkin lymphoblastic lymphoma. Get it out, spit it out. But you were treated in a similar way to myself. You were treated as part of a lymphoblastic leukemia, but you were only 16. Now I was 23 and feel that was young. So I'm absolutely really keen to hear how you found out that you had this disease, and right the way through to today, how you became a hemo-oncology nurse and what made you do it and everything. So the floor is absolutely yours, and I'll ask any questions I think of, but over to you really.
Okay, so hi everyone. I'm really nervous, so if I do stutter, I do apologise. So when I was 15, I was doing my Duke of Edinburgh award with some friends and my brother. And we were going, I think it was in the Peak District, walking up what seemed like mountains at the time. And I didn't really disregard myself as somebody that was unfit or anything like that, but I found it a real struggle, throwing my toys out the pram all the time. My brother got very fed up with me. Then when I got home, these lumps started appearing around my neck. And we went to the GP. GP had said that it was glandular fever, and I'd had all the tests which proved that it was glandular fever at the time. And they said, this could be a chronic thing that could last months, years.
So was it like fatigue when you were supposed to be in Duke of Edinburgh?
Yeah, absolutely really knackered. That was the only way I could really describe it. Didn't really have any other symptoms that I can particularly remember. Yeah. Just really, really tired, the lumps in my neck. And then sort of I'd had time off school because they said the thing to do with glandular fever was to rest, and I was going through my GCSEs at the time, so they said the stress of the GCSEs would make things worse. So I took time off school and things just naturally progressed anyhow. The lumps got bigger, they sort of spread, and all I can explain was like a grapevine in both the sides of my neck and shoulders. And then I lost...
How did you feel? Feeling that? You must have been panicked.
Well, I think because my mum and dad was trying to pacify the situation. I mean, nobody knew what was going on. Obviously, at the time we were told it was glandular fever, and you Google glandular fever and you think, oh, okay, they'll disappear in time, So you sort of live with that. And then I couldn't hear very well out of my left ear. Started off with this, I think you could explain it as like tinnitus to begin with. And it was quite painful. And they said that was because of the pressure of the lumps.
Right.
I had a grommet fitted, things like that. They thought it was still glandular fever at the time. kept going back to the GP again. The blood test showed it was glandular fever, so you trust what your GP says, you know.
Very similar to how I got told it was something different.
And I can't exactly remember how long it went on for, but it seemed like a lifetime of being told it was glandular fever. And then a colleague of my mum's, who she worked for, had looked, and we'd done an ultrasound of my neck, and they said that something didn't look quite right about it, and they wanted to send me for biopsy, so I was sent for biopsy. And then
you were out of school at this point still? You were still out of school?
Yeah, out of school completely.
Revising for GCSEs, or was it just the year of your GCSEs?
I was revising to sit them, so I was out of it. I was trying to do work at home and things, but you know, this was all going on. I'd had my biopsy, and then the results came back, and this was at Harlow Hospital originally. And I remember all these doctors coming into the room with a nurse by my side, and her hand was on my shoulder. My dad was sat to the left of me, my mum was sat to the right. And the doctor had explained, kept going into a lot of medical terminology, and I couldn't get it. And I was like, why is there so many people here? And then the only word that I heard was cancer. Really? That was the only word I heard. And
do you remember how they used that word?
I don't. That's all I remember is cancer. And I was sort of, you don't, you know, at 16 you don't, I mean, you hear about it, but you just don't think that it'll ever happen to you, sort of thing. And
how long ago, without trying to just gauge your age, because I'm not trying to do it for that, how long ago are we talking now then?
So it'll be 10 years, 7 years remission, 10 years since I started treatment. And I started treatment when I got diagnosed in June 2009.
Oh, right, okay.
So just not long after my 16th birthday. But yeah, that's all I remember, and we could see sort of a state of panic in my mum and dad.
I bet, yeah.
And my dad had gone out, all the nurses and doctors went away because they'd obviously given us time to console everything. And my dad had walked out the room to speak to the doctor, and I kind of thought, oh, shit's hit the fan here, you know, Dad's gone and, you know, finds out what's going on. And my mum was, you know, hugging me, and the nurse was hugging me, and were you in
tears at that point, or was it just?
No, I wasn't. I just don't think I even absorbed it at that point at all. But I do remember, I think once my dad came back in the room, asking if I was going to die or not, and my mum and dad had both said, "Not if we can help it."
Wow.
And
how did that make you feel hearing that?
I think you're still, again, you don't really take it in. It was just, you know, you automatically think when you get told you've got cancer, you're going to die. That was what, you know, it's all I thought. And I had to ask that question, and when they said that, I was just like, right, okay, we're going to get through this.
Yeah, wow.
And then we got shipped up to UCLH in London, and it's funny because I remember...
How soon, roughly?
Oh, literally within a day or two, we'd got shipped up there, because mine turned out to be quite an aggressive form, so they needed to act quite quickly. But like going anywhere over the weekend, nothing gets done over the weekend. So we went up, I think, on the Friday, and they'd started me with like pre-meds, I think with steroids and things, to try and reduce inflammation to begin with before starting the intense stuff.
I had the exact same,
Yeah. But I remember UCL, my dad drove, and me and my mum went in the ambulance, because I think, or my dad got the train, I think. I'm not sure, can't remember quite why they went separately. I think it was probably to get home easy, I'm not sure, but maybe they thought they were bringing me home, I don't know, but we got there.
Everything's so chaotic at that point, you don't really know. And
we got there, and UCL's like a massive tall glass hospital, and I was lying on a stretcher, and they pulled me out, and I looked up and thought, oh, this is a nice hotel. And literally I still hadn't, you know, thought, well, what are we doing here, kind of thing. And we got taken up to T12, which was the teenage cancer unit, inpatient unit, and there was a board that said that on the side, and Mum and Dad remember that till, you know,
it said
from day dot, teenage cancer just, and they kind of
it's a reality.
were like, oh God, you know, this is it now. And then you see obviously people with bald heads, and you think, oh, maybe this is real sort of thing.
Did you know anything about leukemia, blood cancer, anything of the sort?
No, not at all. Well,
I don't expect you would, because I didn't at 23.
Yeah.
I just wondered, some people do, and I don't think we educate people well enough on that anyway. But maybe it's easy to say when you've had it. But I had a lot of learning to do.
Yeah.
I don't know about you.
My granddad, bless him, had multiple myeloma and passed away with that. Right. And my dad didn't talk about it a huge amount, but it was obviously, I knew that, you know, that was about sort of thing.
Yeah.
But when I eventually got told, because they said it was going to be Burkitts lymphoma, which would have been 3 months intensive treatment.
Yeah.
But there was a greater...
That's the treatment.
Yeah, but
3 months.
You have 3 months. You go into remission, but I think you relapse quite quickly, and you have to have kind of bouts of regular chemo. I don't know whether it's something you can completely get rid of. I'm not sure.
Yeah.
You know, I didn't do too much research into it, but they eventually diagnosed me with B-Cell Non-Hodgkin's lymphoblastic lymphoma, which I know now is very similar to ALL.
Yeah.
And I definitely had treatment for leukemia, but the only difference was that it wasn't in my bone marrow, so I didn't require a stem cell transplant or anything like that.
So where is it then? If it's not in your bone marrow,
it's in your blood and your lymphoid system.
Your lymphocytic, well, in your lymph nodes in your blood. So it sits on the periphery as well, rather than it's created from within.
Yeah. But yeah, it all kind of, like you say, it's a big whirlwind at the beginning. And when I eventually got told, I asked for the information about every single drug I was going to have. Yeah. I wanted to absorb it. I wanted to know when my hair was going to go. I wanted to know when I was going to be sick. You know, it was probably a little bit of control that I wanted to have over it.
Well, one thing I always think, when the age I was, I'd completed university, didn't have any overheads, any mortgage, kids or anything like that. I was living at home with mum. Felt quite fortunate. You were about to do your GCSEs as well, which is the first big significant thing when you're that age into thinking of your career. That must have just been on hold or thrown up in the air. I mean, least of your worries, but it means you have to, as a 16-year-old, go a different path, did it? Yeah. Or how did it upset everything with your exams and things?
I think because your teachers and your parents always say, you know, with every sort of life bump you hit, like GCSEs, they say, oh, you've got to do well in these to go to the next step, sort of thing. Yeah. So I was worried that if I didn't get my GCSEs, I couldn't then do my A-levels to then go on to university to then have a career, sort of thing. So I was determined to kind of continue with my studies as much as possible, to allow myself a future when this was all over. And
were you permanently in the Teenage Cancer Trust? You were an inpatient. Was that isolation, or was that were you in there all the time, or could you still study and things? Or?
So the way the treatment for lymphoblastic lymphoma was 3 years. First of all, you have an induction phase, and then you have different sections, if you like, and then you go on to a 2-year maintenance at the end. So the induction period I was in a hospital mainly for, and then at home with district nurses that would come in and things. And then in between that, I'd try and do work at home or, you know, go to school. Yeah. And then the maintenance, I tried to go to school as, you know, as much as any other normal person did.
Pick it back up.
But the teachers, the doctors always said, you know, be careful when you're neutropenic and things. Yeah. So every week I'd have a blood test to see whether I was neutropenic or not, and I'd be waiting for that phone call to hear whether I was.
Yeah. Has to be above 0.6.
And
I remember that.
You know, it'd be just below 0.5 or something, and I'd be begging my mum and dad to let me go to school, and you know, they had to put their foot down, and I appreciate them for doing it, but they had to put their foot down and say, look, we're not letting you, and things. And you know, I got invited to parties, I got invited to school concerts and concerts elsewhere, and you know, mum and dad, I thought they were being nasty at the time by saying I couldn't go, but you know, it
was for your best interest, but you don't want to hit that. You know, you want to be back playing with your friends, and certainly at the age, I think 16 is a pivotal age for anyone, but girls mature a lot faster than guys anyway. But 16, that's such a crucial time. I mean, one of the things when I'd written different questions, and you're kind of naturally talking about it, but was how you felt, how you dealt with facing the enormity of a cancer when you're going through that time at 16. I mean, it's unfair to compare ages and stuff because everyone's journey, I suppose, is their own. But do you think it felt particularly harder because you had so many other things that you were about to embark on? You sort of had your future mapped out in your head because it's A-levels and exams. Did you know what you wanted to do? Did you have in mind what the future might hold, or was it? I mean, I'm saying that I didn't at 16, but I'm trying to gauge how much of a disruption at 16 this was.
So I wanted to be a biomedical scientist or something to do with biology. I was always
science,
you know, interested in it. I wasn't very good at it, but I was always interested in it. And that I had a, a line. I wanted to aim for a goal, and I wanted to get it, and
an ambition and
and that was it really. I mean, I don't know how you felt about it at the beginning. I didn't feel like I had a choice. I just got on with it. They've told me that I've got a good chance of this being cured, and I'm going to take it with everything it's got and run with it, It wasn't, I didn't see it a block. The only block was that, I couldn't go out and party and things like that. But to be honest, when you're 16, you've barely done that anyway, so you don't know what you're missing.
No, that's true. That's very true. Yeah, I remember being quite jealous at 23 of all my friends had moved to London. They were embarking on their careers and everything was exciting. People back home, they were going out on the weekends. I wanted to know what they were doing. I did feel I was missing out. I wasn't too upset because I kind of always felt, and I think you've said it felt quite sort of temporary because it was that will hold me back for now, but you've got a bigger plan.
Definitely, yeah.
And it seems to be from when your mum and dad said, not if we can help it, then you grabbed onto that. And I think I did a very similar thing as well.
Yeah, it's, I think I'm quite a strong-willed person anyway, and I knew I had to get through it and come out the other end, and that's why I decided to go back to school to do my A-levels, to ensure that it gave me the best chance of doing that for the future. So I
mean, that's the thing, it's not just one set of exams, you have to think about the next couple of years of your life. You've got a couple of years of treatment lined up as well. So coming on to your A-levels then, you picked the science, I suppose, did you? Or was your exams disrupted enough? Was it a fair reflection of your ability, or did cancer really damage the grades?
Well, I'd like to blame the cancer for that, but I'm not the brightest spark in the toolbox or whatever the saying is. But I definitely gave it my best shot. Concentration was a problem. I laugh now because I wouldn't ever do a full day at school. I'd only do my lectures or classes, and then my dad would get me and I'd come home. And then all I'd ever want to do when I got home was go to bed and, sleep. And my dad would be there cracking the whip saying, come on, you've got homework, coursework to do.
Revision.
But he did it all, to help me. And now being a nurse, I can see that a positive mind and a strong physical body, being physically active really, really helps people get through cancer. So I think my thing for helping me get through cancer was school.
So it's a positive for you then, really?
Definitely, yeah. I mean, school life then wasn't great, just struggling with keeping concentration and just life in general. But it definitely was my thing to help me through, that's for sure. And I'm grateful for my mum and dad supporting me and pushing me when I needed the kick,
It's interesting hearing because I remember struggling with concentration levels during and after my treatment. I'm still struggling out to a certain extent. It constantly gets pointed out. But having to do exams, and all people talk about when you're 16 is GCSEs and A-levels, and that is, my mum used to drive into me, just get your GCSEs, then get your A-levels, you can do what you want. So to potentially have that compromised could add a lot of pressure, when you're facing something far more important. I think it's really commendable that you even chose to do them then, because I'm sure you could have deferred or something for special reason. I'm sure there was dispensation for that. But you got back, so you got into A-levels one way or another.
Just about scraped.
And so you said you wanted to be a biomedical scientist, so I suppose you chose an A-level that could, so you still carried on the path that you wanted, basically.
Yeah, so I did biology, chemistry, English, music technology. I think that's it. I left the physics to my brother Stuart. He's the physics genius. I tried to do the others, but not very well. But as I was going on through treatment, I just realised that I wanted to help people that had helped me, you know, and give something back to, you know, the people that had helped me. And
was there a particular moment that made you realise that? Was it just you going through your own?
Probably not getting very good grades to be a biomedical scientist. No, it was just a natural thing, I think, because I've always been quite caring a person anyway. And Mum, I think it was my dad, had suggested it in the car when I had just almost given up on my A-levels because I was finding it so tough, you know, keeping up with the coursework. And I wasn't ever in school 100% of the time. My attendance was probably, I don't know, 40% or something, because, you know, I'd have to be at home or having chemo. And
that's tough at that age, to be doing anything different than the norm. Is difficult because you just want to be a part of the crowd and you just want to be doing it. That's another burden to have to deal with, I think.
But Dad had said, you know, I think you'd be amazing at being a nurse and think how you could help others and stuff. And
huge influence.
You know, it was, my dad's my best friend. He's, you know, the man I look up to.
You can tell, But that's good to have that encouragement, because often I think people don't know what to say, they don't know what to do, and they want to be able to help people. My family were great for me, and I was 23 years old, I suppose, so in a different place, and I'd done my degree. I was still clueless. I still am in a way. Never whisper that. But to have that encouragement of a path, that kind of linear journey where you think I can achieve that, I think that must be huge, and I think that could really help people. And I think, thinking of people who listen to this, I did a podcast on, for me, the importance of setting goals and things like that, and that was something to do with running, I think, which actually taps into what you're saying. Physical activity and things can help the mind and help you when you're going through this. But I think the importance of having something to drive you forward beyond just your illness goes alongside it. I think it sounds like you've encountered that with your goal to do the work that you're still doing now. We're obviously doing.
Yeah, it was. I mean, I'm a strong believer that everything happens for a reason. You know, and I've said to you from day dot that as much as I'd have never wanted this in the first place, and I wouldn't wish it upon my worst enemy, I wouldn't take it back now, because I'm doing something I love, and I'm helping people, and that's all I could ever ask for. So. And
what a positive mindset to have on the face of it. People are different. Some people just want to wipe it away and forget their illness and do things. I obviously bleat on about my own a lot because that's how we met. But there are times when where you can be quite resilient to it because you're used to talking about it and stuff. But what amazes me about you is you push through from your A-levels to carve out a career. Did you know back then you wanted to go back to care for people to do with blood cancer?
Definitely.
Did you?
Yeah, that was the only way I was gonna. I'd taken and absorbed so much information, and I'd seen how the nurses worked, and I saw the good nurses and I saw the bad nurses, so I knew what I didn't want to be, and I knew what I could add to the job role as such, and that was it. That was, my mind was set and I was going to achieve it, whether, it rained or shined. That was it, And
no one tried to not talk you out of it, but what sort of amazes me about you is I considered that world. I had people saying, well, why don't you retrain and do it? And I just thought, God, to be a doctor, to be anything. I don't even know if I could, but I certainly thought, I was fascinated by the science of everything going on around me. I wanted to know each and every drug that was happening and what its purpose was and things. I think maybe to get a sense of control on everything. But it did float past my mind to think, do you know what, could I actually retrain to this? I chose not to because I thought, I was probably just thinking I wanted to fast track my way back into work rather than go back and train from scratch. And actually I think that's probably a better fit because it's sort of talking to people about things, it probably suits me better. But I definitely encountered that. I just wondered if people might have thought, obviously that was the opposite in driving you forward, but if it ever crossed your mind that actually this could be quite upsetting to go back into the world you've come from all the time. Yeah,
it was a big discussion, I think, as a family that we'd had, and we spoke about it, and it was all still very raw to me, so I was still very emotional about the whole thing. But I think I don't do teenagers. I was a teenager when I got diagnosed with this. Maybe if I was caring and treating teenagers at the Teenage Cancer Trust, things may be different. I might find it more challenging because, you know, I can really, really relate to that. That's exactly what I went through.
Yeah.
But with adults, they have a different outlook to it than, you know, teenagers do anyway. So it's easier for me to kind of keep my emotions intact. And sometimes it does catch you out, you know, don't get me wrong, there are times you have to take yourself away and sort of...
On the job, you mean?
Yeah. There's just certain things
You're
that
human,
just... Yeah, and, you know, we were talking earlier about things that jot your memory and stuff.
I was about to bring that back up. It'd be good to just go over what we were talking about, because that you said you had that instance. Do you want to pick it up?
Yeah, so I was sitting by the river in Ely with my partner, and there was a school prom going on, you know, with all the girls dressed up with their boyfriends and things. And I'd gone to prom, but with no hair, just come out of hospital, looking pale as anything. And that just brought that whole thing back of, I wanted to be involved in it, but at the same time you feel like the outsider, no matter, you know, how much people want to involve you.
No, I think that's right. And I said I had a similar thing when I was driving past the hospital last year where I had my chemotherapy, and it caught me out. I may have mentioned it on a previous podcast, I'm trying to remember. I've certainly mentioned it to people. But sometimes the rug can be pulled from under you, and it can be something that you haven't prepared for, and it can be watching something on telly, anything that jogs your memory. Because I talk about it a lot and I interview people about it a lot, I'm kind of playing a role, so I've already prepared myself to put my own emotions behind me. But I do wear my heart on my sleeve generally as a person. So that moment when I was going past and I was telling my girlfriend at the time, that at the time when I was driving back when I was ill, just how I used to do this journey a lot. I mean, this was only last year, and it totally caught me out. And I relayed a story of when I was temporarily back home and about to go on that journey to the hospital, and my auntie and cousin came over, and they'd only come over because I was ill. It just brought it back, and just by talking about it, because I wasn't talking about my story as such, I wasn't doing the talk I normally do, it just caught up with me. And it sounds like you encountered a very similar thing at the prom, because you don't forget it. You might be able to move forward and stuff, but you don't. But certain things you haven't quite put to bed. You know what I mean? And I think it can lie on the surface a bit. I mean, it reminded me of the scene. I don't know if it's My Sister's Keeper or The Fault Under the Stars or something.
A Fault in Our Stars.
A Fault in Our Stars. Yeah, there's a book as well. I think they're both books. But we had a conversation when you picked me up from the train station earlier about things that do and don't reflect, like films and TV that do a good job of putting the reality across against ones that didn't. I mean, if you were, did you have any sort of? Yeah,
so I remember watching the Bucket List, there was a guy in it, I can't remember the actor, who was having chemo, and he had his head down the toilet 24/7, and I just, as soon as I, you know, heard about the treatment and being sick, I thought, oh Jesus, I'm going to be spending, you know, the next 3 years with my head down the pan. And it, you know, I'm not saying it's the same for everybody, but I didn't have that really at all.
It's like a stereotypical reflection of it rather than reality.
And you hear all the doom and gloom in the news and things, and you just think, you know, things like this, us doing the podcast, really needs to be put out there more for people to see that there is, you know, some good, well, not good, but positivity in it. It's not all negative, you know. Absolutely. Side effects and things. But yeah, I remember my dad's friend, when I was at my lowest ebb, bought me I can't remember the name of the book, but it was the Lance Armstrong.
Is it called Livestrong? Or
that's his charity, but I'm not sure what the book was called, but he'd brought out a book talking about when he'd got diagnosed with testicular and...
Actually, he's done 2, hasn't he?
Yeah, didn't he have brain mets or something, or lung mets? I can't remember.
Yeah, so it went to his brain. He had testicular, I think, that spread to his brain.
I think so, but it'd gone rife, and reading that gave me inspiration to think, wow, you know, he was a Tour de France winner, going through all that. You know, I can go to school at least and get my ALevels and have treatment and come out the other side. And
so
then
that inspired you?
Definitely.
Despite what we now know about all that, I think the inspiration bit shouldn't still be
No, definitely, It's the positive stories definitely need to get out there more, for sure.
And what if someone's, I don't know how many 16-year-olds we get listening to this, to be honest, But the way we push it out, and various clinical nurse specialists up and down the country, they do push it to people. Now, if you remember back to how you felt when you were 16, having gone through it and come out the other end and gone back to care for that, if you were caring for someone currently who is the same age you were, is there anything of note you think that you really needed back then that perhaps you didn't get, or that would have helped more? Or is it a case of just seeing people who've come out the other end?
I think it's a bit of both. I think it's hearing positive stories.
Yeah.
I think positive stories, you know, for your parents as well is always quite good, because I think my mum and dad found it a lot harder than I necessarily did. In terms of, I just got on with it and they had to watch, you know, the struggles and things. I think support is huge, and especially because half of my treatment was at home. Well, not half of it, probably a quarter of it was at home. So you had district nurses coming in, but I think more home support, more just support in general for families going through something like this. Because like you say, there's a lot of elements involved, you know, my school life, puberty, etc. And a lot of it wasn't considered, because it was just, oh, you've got to get on with it, you've got to get through the chemo, and that was it. And we were kind of left to sort of work out our own path, kind of thing. But yeah, it's hard to say really, because everybody's journey is so different for what people, you know, prioritise and stuff. But for me, school was my biggest
bit of escape.
Escape. And you know, for anybody, you know, that could cope with going back to school at that age, it's definitely the thing that helped me get through it. So.
And we spoke off air, offline, whatever you want to call it, before we started recording about. I think I picked it up in the talk I gave, and I have to talk about this, how I'd have to get patted on the back. And I think you said you had people saying, you've done so well, you're doing amazing. Well, actually, what choices? Do you know what I mean? When you're going through it, you haven't got a choice, there's no way out. You can get all the support in the world, but you have to do the work yourself. Sometimes it's the impact on those around you, I think, that can be... I often worried about that, about how my family were feeling. Sometimes I put on a brave face in front of them. I don't know if you did the same. But seeing the impact on other people is actually out of control, and I felt it was almost easier to be a patient because I knew what my plan was, and I had a path and a daily goal and a quest to get through this, whereas they had to just almost cross their fingers and hope that the person they care for most. That can definitely have an effect. I think those type of things need to be flagged as much to other people as well as the patient. Would you agree?
Yeah, definitely. And I think, like I tell my patients here, as the cycles go by, you learn your normal, you know, you learn how your body reacts to the treatment. And like making a diary of things, on day 3 I felt nauseous, on day 7 I felt tired and things like that. So for me it was very like logical through the cycles that, oh, here we go, week 2, so I'm going to feel rubbish, I'm not going to be able to go to school, blah blah blah. But whereas my mum and dad, it was like a pick me up when I felt good, or you know, she's feeling really good, and then back down again. It was, how do we pick her back up again, and all this, you know, it was just a constant up and down, and then just, you know, things happen, like you get admitted to hospital out of the norm, and you know, you get seriously ill, and then that throws stress in the air. And
you said about when you were getting taken for chemo in the London traffic, and the stress that can cause.
It's I mean, we laugh about it now, but the amount of road rage that my dad had experienced driving us to London.
I get it in London.
So it's and for my mum as well, you know, although she didn't drive, she was absorbing all that anger, and you know, we were all panicking, thinking, are we going to get there in time? And you know, it was just an added extra stress of everything.
How does it feel? Is it quite cathartic to commit all your time and your profession now to caring for those people, like in the same world you were? Do you feel like not a sense of closure, but do you think it helps? Does it help you more? Did you need it as help, or do you just get so much out of it?
I get so much out of it. I don't feel like it helps me in that I can shut any doors, because I felt like I did that at the end of treatment, which I think for mum and dad was the hardest thing for them. You know, I'd started off as a baby, and they'd matured me, you know, they brought me up to be a woman of 16, And then within the space of 6 months, I'd then turned back into a child again that needed care of washing, feeding, you know, giving me medication, things like that.
Yeah.
And then all of a sudden, when I hit 18 at the end of treatment, I'd flew the nest, you know. I'd gone to university, I'd moved to Cambridge. You
had a plan, yeah.
And, you know, now I've met an amazing man that I plan on spending the rest of my life with, and my poor old dad is at home crying his, you know, self to sleep every night. But
there's a sense of loss, I suppose, because they've had to care for you. I mean, I think the way you described it was perfectly, that you rear your children and you teach them everything, then this cancer brought it all back where they had to do that again.
Yeah.
But you'd kind of, it's amazing that you've been able to, some people probably, and I've experienced this with people I've spoken to, they're almost a bit scared to take that next step forward, and they probably stay back home, and it takes them a little while. You were gone by the sounds of it. Like you dealt with it quite quickly. Actually closed it off. Although closed it not in a sense that you don't want to talk about it, because you live in that world day to day. I think you must stand out as a real one-off, I think.
I think I'd still got my goal of becoming a nurse at that point, so I was going to university and that was it, and I'd had the goal of getting a first class honours, and I did, and that was it.
Didn't know that. We haven't spoken about that before.
I got
Congratulations.
And I did it. Yeah, that's it.
It's brilliant.
And I had all these goals, and that was, you know, that's how I probably go about my life, is just goals. This is what I want. This is what I'm going to reach, sort of thing. And I did, and you know, I went to Anglia Ruskin because it was attached to Edinburgh, which was the teaching hospital.
Yeah.
But there's actually an Anglia Ruskin in Chelmsford, which is where my mum and dad live, and mum and dad asked why I didn't bother going to Chelmsford or why I went to Cambridge. But I think part of me wanted just a new life, you know, and to move on like the rest of my friends had as well, you know.
Get yourself back on track.
Yeah.
You've clearly been driven. I mean, the thing that you said helped you when you were first diagnosed was the fact you had your exams.
Yeah.
And what helped you afterwards was pursuing that career.
Yeah.
That's, I think, a godsend. I mean, having that dedicated role, I never really knew what role I wanted or career, but I kind of wanted to get travelling, I wanted to go and see places, and that drove me. So as long as someone has something to drive them forward, I think that helps them. I mean, and similar to what you said about perhaps your dad and your mum perhaps were sad to see you go, I think when because I'd been away to uni, but then I'd come back, then I'd got ill, so I was back home with mum. I only lived with my mum, so for me to go off travelling and move to London and stuff, I mean, it feels perfectly normal now. I've been doing it for so long, but I didn't, you know, I mean, they were just like, he's got to do what he's got to do, but there might have been a sense of loss there, do you know what I mean? A sense of, not in a, I mean, listening, things could have been a lot worse for both of us, but I still think it's important to recognise that actually other people have to deal with it as well, the ones closest to you, but I remember my mum just said, well, he's just got to do what she never once would try and stop me doing anything, she never has.
I think it was just a massive change of purpose, like, you know, my mum and my dad, their purpose was to support me and, well, keep me alive, if to be so frank, you know. And then I fly the nest, and obviously your mum and dad are always there 24/7, no matter what anyway, but it was a different kind of purpose. It was, I don't know, like normal parent purpose, not you know, my guardians, if you like.
No, I had to get back to being a mum and dad.
Yeah.
That's a really lovely way.
And then you live, because I'd missed those 3 years, you're then living those 3 years at the age of 18. So things like going out drinking, partying, boyfriends, things like that is all new to mum and dad.
Yeah.
And that was hard in itself, you know, letting go and appreciating those things.
Well, I think that even one of the questions I asked earlier about the significance of your age and your illness, you've actually just touched on it. You had to live that part later.
Yeah.
I felt I had a bit of catching up to do with first job out of uni and trying to get my feet. I felt like my friends were all accelerated, earning good money, and I wanted to just try and get back. I wanted to go back and teach myself some new skills. I really, for a long while, felt like I was lagging behind, which actually in the grand scheme of things isn't important, but at the time it can bother you that you haven't had these experiences that you feel you need. One thing I wanted to touch on, because I think we're covering loads, which is great, and you're answering everything I sort of preempted that we talk about, was maybe the challenges and the highs and lows of the role you do. If there's any of those, maybe there isn't, but do you encounter any challenges, because you know that world so well from your own experience? Are there challenges with that?
Yeah, I mean, it's hard really because it's different kind of challenges. You know, I'm here to support the patients in their decision, whether it might be the right decision or wrong decision. I'm there to support them, and sometimes, you know, with my outlook of I don't have a choice, well, the patients we treat are of an older generation as such, or older, and you know, what they find what's important in their life might be just living the next 3 years with low dose chemo and not intensive to try and get them cured or into a deeper remission. And for me, that's a struggle to understand how
someone can opt for the other one.
Opt for the other one when I was, you know, like, well, if somebody gives me 1% chance of curing this, like, I'm going to take it.
Yeah.
But that's a different mindset of somebody that's 16 and somebody that's 70 or what have you.
Of course.
You know, maybe not 70, but
and
still.
You can't impart your views on it. You can just hear them.
Exactly, and you have to
decision.
support them with everything. And that's hard for me then, having to relate to that, because I find like my what I've been through doesn't relate to that in any way, shape or form. So, you know, there are hard bits. So there's, like I mentioned earlier, there are occasions, you know, I find it emotionally difficult, but I think anybody with a heart would find this job difficult. But I try and take as much positive out of it and use my experience as much as I can to help others. So
well, it takes someone with a great heart to do the job you do, let alone, it doesn't sound like that's based on your own illness, that's just you wanted to care for people irrespective.
Yeah.
But having gone through it yourself just gives you sort of a bit more of a strong arm in that world, I suppose.
Yeah, definitely.
Oh, that's amazing. So my other question was what life looks like for you now, but it sounds like you're very happy. It's a lovely day in Newmarket today.
It's
so
gorgeous,
you're in the right place.
Life is amazing at the minute, and I couldn't be much happier, or any happier.
Brilliant.
I'm looking to be a clinical nurse specialist in haematology.
Wow.
To focus on that sort of patient group, and hopefully going into clinical trials, which is another interest of mine as well. So yeah, we'll see where the future holds in terms of career anyway, and then home life. Well, eventually kids maybe one day, so you know, I can tell them this story,
all the story about it
and that lot, but that's probably a way off yet anyhow.
But you've got a plan, as you've always had.
Always a goal, always.
That's
I think
amazing.
You know, that for me that's the main thing. So
that's brilliant. We often ask people, this is a sort of generic, almost cheesy question really, but what makes you be positive? It doesn't really even work as a question, but I suppose it's just to get the word be positive in. But what brings you your happiness, and what brings you the positivity for your life?
Just life and helping others, and one day having a family of my own, you know, see how close me and my mum and dad are, and I want that one day, so... And
carry that forward.
Yeah.
That's amazing.
That's it, really, that's me in a nutshell.
A 42-minute nutshell. No, that's brilliant. Thank you very much, Catherine. I think
Thank you.
From the moment we met when you spoke to me after the talk, I've met loads of people, but you particularly stand out because you greatly inspiring by the way you've come full circle with a lot of highs and a lot of lows, encountered it at a young age, and I feel I was quite young when I was diagnosed. Obviously you get young babies with this disease, but someone at 16, that throws your world up in a different way. As I said, I felt mine fell somewhat lucky in terms of after uni and just planning my next steps, but you had to deal with a lot more than that. Then to turn it all around full circle to care for people, but I suppose you always had that goal, which has helped. But I imagine I always say when I was being treated, all I wanted was to see someone who'd come through at the other end. To be treated by people who, like yourself, care for you, but have also got some understanding of that world, would help people no end. So it's been great chatting, and I'm sure people listening to this are going to really be inspired by it.
Well, thank you very much for having me.
No worries, we'll get you on again.
Wonderful, wonderful. Thank you
very much. Cheers.